Afternoon, Mr. Chair and members of the board. So lastly, on the report summary that you received, the last segment does talk about prevention, treatment, or therapeutics, and just wanted to highlight that our staff have put together a website that provides information on the therapeutics that are available, because over time there's more and more that's been added, and some of it has to be administered at certain times. You also have to check for interactions with certain drugs. So a lot of information that providers need, and so we've provided it on this website. Also wanted to point out that the federal government is promoting a program called Test to Treat, where individuals could go to certain pharmacies or FQHCs, get the test. If it's positive, then they would get the assessment right there and then for being able to start treatment, especially for the oral therapeutics. And so being able to provide information to the general public about where they can go to be part of that Test to Treat is important as well.
Okay.
So I wanted to provide some information over time. You all have asked for information about deaths, and so wanted to be able to provide that information to you. In the packet that you received is a fact sheet, so you'll notice that all the information on the fact sheet is what is in my PowerPoint presentation, but just wanted to highlight a few things so that you will know, and also give you an opportunity to ask questions. So with this first slide, it shows the deaths by age group, gender, and race ethnicity, and wanted to point out that for the years 2020 to 2021, 180,000 cases, we received 182,000 cases of COVID-19, and of that we had 2,604 deaths. And by age group, you do notice that, especially in 2020, a large percentage of those were in the age group 60 plus. That percentage did go down a bit in 2021, and a lot of that was because of the efforts in vaccinating people who were in long-term care facilities. We did not have large outbreaks in 2021, and the death rate also in that age group did go down. We also did see an increase in cases among the young adults, and you can see that the number of deaths also increased in that group as well. When you look by race ethnicity, wanted to point out that the Native Hawaiian Pacific Islanders were hit real hard at the beginning, and so that's why you see that very high case rate as death rate as compared to other race ethnicities. But we've worked really hard with them to provide services, as well as when the vaccine was available, we had a special program where we were actually having outreach specifically to this community and working very closely with them.
Dr. Kisari,
yes.
Pause just for a moment. I think we have Supervisor Frost, you had a question?
I just wondered if you could, on the Test to Treat program, what is the treatment protocol? Is it an early treatment protocol, and what is the medication that is approved?
There are two medications that are approved for early treatment, Paxlovid and Molnupiravir, and those two are oral treatments, and so those are the ones that are offered at the pharmacies and FQHCs as part of the Test to Treat.
What kind of medication are those? Are they
they're
antibiotics or antivirals?
Yes.
And I'm sorry, you said Paxlovid and
Molnupiravir.
Thank you.
I can also provide details on those medications as well.
Thank you.
And then the monoclonal antibody is usually given either by injection or by infusion, so that's offered at the hospitals.
What is the test in order to be treated? Is it a PCR test?
Most of these have either PCR or the antigen test.
Thank you.
Okay, good. Thanks. Dr. Kiseri, go ahead.
So on this slide, you can see the comorbidities. I think that's something that we've tried to stress over and over, that in many of the individual or in the deaths that we were seeing, the individuals did have comorbidities. So we have information on 1,710 of the deaths, and you can see that especially the three comorbidities were pretty high: hypertension, diabetes, and heart disease, and obesity as well. This came up again and again with different deaths. So we want to highlight this because sometimes when we are talking to the public about people that are at risk, sometimes people are only thinking about individuals with cancer or individuals with compromised immune systems. But when you think about the number of people in our community that have hypertension, that markedly increases the people at risk, and it is important for these individuals to make sure that they're up to date with vaccination as well as wearing masks, especially in high-risk situations.
Dr. Kiseri, we have a question from Supervisor Stern.
Thank you, Chair. So just a quick question about the comorbidity types here. Is the type of comorbidity, is that a determinant that is influencing the fact that the male population is generally more susceptible to death from COVID than the female population? In other words, if you were just to chart outside of COVID, just chart the morbidities type for male female, would it be kind of a similar chart?
I don't have that information here, and I can definitely ask to get that detail. But
I was just curious because it's a statistic that has been front and center since the whole pandemic started, that we've known early on, and it's been consistent that males are prone to dying from COVID more so than the female population. So I just wondered if that has everything to do with the status of different types of morbidity types by gender.
It probably plays a large role, but you also need to remember that other factors include exposure risk. People working in certain sectors that put them at risk also increased their, getting the disease, and then if they had the comorbidities, that also increased their risk of ending up dying. So yeah, I think it does play a huge role.
Thank you.
Excuse me. Can I ask
Yeah, Supervisor Frost, go ahead.
these deaths by comorbidity, when is the timeline? Is it January 20 to January 21, or December 20 to December 21?
So this, the deaths that the information that I'm including includes all of the deaths for 2020 and 2021 due to COVID.
Okay, because there was a significant increase in deaths after December 2020 when the vaccine began to be distributed. There were year over year from 2019 to 2020, there wasn't an increase in deaths worldwide, but from December 2020 to December 2021, there were an explosion of symptoms such as cardiac, reproductive problems, neurologic, strokes, bleeding, clots, which looks rather similar to the comorbidities that are listed here.
Actually, that's not correct. And I did present information on the increase in deaths and showed that when you looked at the increase, a large proportion of the increase in deaths was due to COVID disease. And then what I'm showing here has no correlation with when we started doing vaccinations.
Okay, so I guess my question is, people who are having these vaccine injuries, do we have a resource for them? Can they get help with these vaccine injuries that we're seeing?
So I just want to make clear that the information I'm providing is not about vaccine injuries. And I did provide the supervisors with information from the CDC about vaccine injuries and also the ones that have been verified. When there is a vaccine injury, a provider can submit that information into a database, and when that information is received, they then get additional information as to where the person who the patient can get additional help. But that's not what I'm talking about in the presentation today.
Okay, well, I wanted to express that I think it's really important that we as a board look at all the information and test the science and look at all the information that's coming from everywhere, not just one source like the CDC. And I'll leave it at that. I let you continue your presentation, but I wanted to go on record as saying there's a lot of information out there that we should be looking at just to ensure that we're making sure that what we're promoting and recommending, which I have questions about whether or not it's appropriate to promote an emergency use authorized drug and for us as a government to be practicing medicine. I think that's the job of doctors, and I'll just leave it at that.
I guess I appreciate what you're saying, but I think that my role as a health officer for Sacramento County is to be able to provide that information, and I do appreciate the confidence that I have received and support that I have received from the Board of Supervisors in doing my job. It's been a challenge in the last 2 years.
It's not a criticism of you. This is not a criticism of you. You know, I've had conversations with doctors who have said we're no longer able to practice medicine. If we knew of something that would help someone, we can't prescribe it because of the government has basically, the CDC has basically captured Western medicine, and we have a certain protocol that we have to go by, or else we lose our license. So I think these are important. This is part of, you know, medicine and medical freedom, and it's important to have these conversations, but I'll let you go ahead with your presentation. This is not a personal attack on you, Dr. Kasiri. I know you're doing your best to do your job, but I think it's my job to tell the truth about what I know and to ask questions and try to get answers to questions that I think are important. And I think we still live in a free country where we can do that. So I appreciate your patience with me, and I'll let you go on with your report.
Okay. Dr. Kasiri, you're going to finish. I have Supervisor Cerna want to weigh in as well. Is there anything else you wanted to, you were offering some comments. Is there anything else you wanted to?
No, I can take his comment.
Okay. All right. Very good. Okay.
Question. You're a doctor?
Yes, I am.
Do you have doctors that work for you?
Yes.
And those doctors working with your leadership and the leadership of our health services director have been very focused, engaged, including engaged on the risks and the benefits of vaccines since the pandemic started?
That's correct. And in addition, we also work very closely with the doctors in the hospitals.
Great. Thank you.
Thank you. So again, I just wanted to point out that the focus of my presentation today is about the deaths, because this, due to COVID, this is something that has been of interest to the supervisors, and we received a request to provide additional information, which I am presenting today. So then when you look at hospitalizations, of the 1,929 deaths with information on hospitalization 87% of them were among people that were hospitalized, about 26.7% among people that were not hospitalized. So basically, these are people who either died at home or were brought by ambulance and pronounced dead in the emergency room or died within the emergency room. So basically, either their disease progressed very quickly or there was a delay in getting to the hospital. And there was, I think, one point where we were very concerned, where we were getting a lot of those reports from the coroner. But I think as we saw more capacity from the hospitals, we were no longer getting those reports. Also important to point out, a large number of them were in the intensive care unit. And again, this just a point of showing, that people that had very severe disease and ended up in the hospital, a certain proportion of them did end up, unfortunately, dying. When you look by vaccination, that's the circle at the bottom, and that's a question that you have asked us several times. About 13.7% were fully vaccinated and 86.3% not fully vaccinated, meaning that they either did not get any of the shots or got only one and did not complete the series. So just pointing out the importance of being able to be up to date with vaccinations in order to get full protection. And then this is...
Yeah, I'm sorry. Supervisor Frost?
In the hospitalized, 86.3%, was the treatment protocol the same as this early treatment protocol, or was it remdesivir? Do you know?
No, that's different. For people that were hospitalized because they had severe disease, there are different treatment regimens, which did include remdesivir. Some of them had to go, and of course also supportive treatment, and also some of them did have to go on ventilators.
Okay. Supervisor Desmond, you had a question as well?
Yes. Excuse me. Thank you, Dr. K, and thank you for everything and for this presentation. The slide on the deaths, this slide here. So not fully vaccinated, that would just include folks who didn't complete the series. That does not include folks who just didn't get a booster.
Is
that correct?
It does.
Both.
Okay, it's both. Okay. Thank you.
Okay. All right.
And I think this is my last slide. This was a request from Supervisor Cerna, who wanted to see in comparison, the comparison of different states based on the percentage of population that was fully vaccinated. So on the x-axis, you can see it's the percentage of population fully vaccinated, and y-axis is the deaths, the death rate. And you can see that in the box on the far right that shows Contra Costa, Alameda, and San Francisco. These are counties in California that had the highest vaccination rates. And also you can see that they had the lowest death rates as well. And you can see where USA is in the middle as well as where California is. So in general, what this slide shows is that for states that had low vaccination rates, they tended to have higher death rates due to COVID. And I think that is my last
I think you have one more. No?
Sorry, Dan? Oh, yes, I forgot. I added this afterwards. Yes, this was an update that we received from the state, and I thought that it would be good information for all of you to know what we're focusing on and what our targets are. So the state has given us a target of 70% fully vaccinated for all of the different categories. And these two slides, graphs show you where we're doing well and where we still have work cut out for us. The ones in blue show you by race, ethnicity, and it shows that, especially for the Asian population, we've tended to do pretty well. The Native Hawaiian and Pacific Islanders, as I mentioned, we had special programs to do outreach and provide vaccination, and we did especially well in the older age groups. But for the other race ethnicities, we still have a lot of work to do. And then in the orange shows you by quartile, basically this is for health equity purposes. And the Q4, the fourth quartile is the lightest color, and that's in areas that are more resourced, well-resourced. And then Q1 is the disadvantaged communities. And you can see that for each age group, we tended to do better for the older age groups, and then also we did better in the higher resourced communities. We continue to work with community-based agencies and SAC Collab to do outreach, and we also appreciate all the support you've given us in being able to continue to do the small clinics within the different neighborhoods. We still have, they're small, we have maybe up to 50 people that show up, but we know that people are very appreciative that they still have the opportunity to go to those sites in order to get vaccinated. And I think that is the last slide. Thank you.
Okay.
Just wanted to wrap up with just a couple of quick comments.
Siobhan, I think before you go, I think Supervisor Cerna wanted Dr. Caceres.
Thank you, Chair.
Yeah.
I'll be brief. First of all, thank you for the additional chart. I think it's very interesting, very telling. Do we have anything on our current dashboard website for COVID-19 that is advising our constituents who are eligible about acquisition of the second booster?
We have some information that we have put out, but we definitely need to do more. We've been talking with our PIOs about being able to put out additional messages, especially what we have found useful is using social media. And so that's what we've been using the most for that information.
Do we have any county sponsored clinics today that are administering the second booster?
At each of our clinics, we do offer the second boosters. I don't know what clinic we have available. I didn't bring the list of clinics for today, but we can certainly get back to you on that.
Okay, I just suspect that as time progresses, there's going to be more interest by the 50-plus crowd, especially about how to acquire that second booster.
Yes.
I being one of them, so I would be personally interested in understanding where I can do that.
Yes, we'll get that information out.
Great, thank you very much.
Good. Okay. Again, Siobhan, before you wrap up, Supervisor Frost.
I have a question regarding informed consent. Are people being notified when they get this vaccine that there are adverse reactions such as heart, reproductive, spontaneous abortions, neurologic, stroke, Bell's palsy, Guillain-Barré, a broad number of vaccine reactions that supersede all the years that VAERS has ever been in existence, which was, I think, the early 90s. Are we telling people that before we give them the opt-in or opt-out, the option to opt in?
So first of all, there have been very few adverse events, and I did provide you with a report on the verified adverse events. And we do have a standard informed consent that we use that is approved by the state and the CDC that does provide that information. We know very clearly that the risk of these complications due to COVID are much higher than they are from the vaccine. We've had only a few verified reports. And some of the information that is online about things like reproductive risks have not been shown to be accurate. So we continue to provide accurate information about what the risks are. And what we know is that the risk of COVID-19 is much higher and the risk of complications is much higher.
You know for a fact that the risk of COVID is higher for a 5-year-old, for a young child?
Yes.
Than the risk of adverse event with the vaccine?
Yes, and
I don't think we know that, but we can agree to disagree.
We can provide the information of tests of the studies that have been done and the fact that before approval, it goes through a rigorous process before the FDA does even give the emergency use authorization.
Thank you.
All right, Supervisor Cerna.
Great, thank you. Along similar lines, Dr. Kasseri, we are still hopefully very much engaged in a campaign, a focused effort to underscore the fact that you are more likely to suffer the symptoms, including death, from COVID than from the vaccine, correct?
That's correct, yes.
Great, thank you very much.
Okay. All right. No other questions at this point. Thank you, Dr. Kasseri, for going through that. And Shavana, I think you wanted to go ahead and make some
Yeah, I just wanted to make a final comment. Last week was National Public Health Week, and it was a great opportunity for us to recognize our staff and to really lift up the important work that they've been doing throughout this and before, and the important work that they'll continue to do post-pandemic, as we have a lot of other issues that we'll continue to address when it comes to a public health perspective and ensuring the overall health of our community. I also wanted to say that I know we don't say this enough, but we are very lucky to have Dr. Kasseri as our public health officer here in Sacramento. She is well respected amongst our field and amongst all the medical professionals in our community as well. And so I just wanted to give her a shout out and a thank you, and her team, and let them know how much I appreciate living in Sacramento, because I feel safer because of it. So thank you.
Likewise.
Thanks, Shavana. Okay, great, very good.
Thank you.
Okay, all right, well, stand by. I don't know if we have folks on the